Bonjour, je m'appelle Lars Willubert, je suis directeur exécutif du Labor Dynamics Institute à ILR School à Cornell University et chercheur senior associé à Cornell aussi. Je préside le comité scientifique du Centre d'accès sécurisé aux données CSD en France et je sers comme conseiller senior du New York Federal Statistical Research Data Center aux États-Unis. Il me fait plaisir, en tant que membre du conseil d'administration du réseau canadien des centres de données de recherche, de souhaiter la bienvenue à tous nos participants canadiens et internationaux. Nous sommes très heureux que vous soyez des nôtres pour cette conférence virtuelle, présentée en partenariat avec Statistique Canada. The title of today's panel is Microdata Access, Perspectives from Canada, France, the UK, and the US. It's my pleasure to welcome 4 panelists who will share their experience of how microdata access is evolving in their respective countries. Each of our panelists will present opening remarks for 6 to 7 minutes. This portion of the panel has been pre-recorded. We invite you to submit your questions as you listen to each speaker. We will get to as many of them as possible in the live Q&A that will follow. Without further ado, I'd like to invite Michael Wolfson, adjunct professor in the School of Epidemiology and Public Health and Faculty of Law at the University of Ottawa, to kick off today's panel. Michael retired as Assistant Chief Statistician, Analysis and Development at Statistics Canada in 2009. He was awarded a Canada Research Chair in Population Health Modeling in the Faculty of Medicine at the University of Ottawa for 2010 to 2017. He's a Fellow of the Canadian Academy of Health Sciences, an elected member of the International Statistical Institute, and a member of the recently created Canadian Statistics Advisory Council. Michael, over to you.
Thank you very much, Lars, for the kind introduction. I have some slides, so I'll move to those right now. So let me start with an introduction about the power of microdata. I expect everybody in the audience appreciates this, but let me just emphasize that it really enables major advances in knowledge and our understanding. In my remarks, I'm going to focus on research and statistical analysis, especially in health and economic domains and with related public policies. There are a number of wonderful features about microdata, especially the things that we would like it to have. We want to be able to have data that represent populations with large sample counts, given these extensive heterogeneities across the population. Multivariate information is really important because we appreciate that causation, understanding what's going on, is multifactorial and often crosses disciplinary lines. Longitudinal microdata, as opposed to cross-section or repeated cross-sections, is really essential in order to observe and understand individual-level dynamics. And increasingly, we want to be able to understand phenomena from multiple level perspectives. For example, individuals in their household context and then in their communities or schools. All of this has been tremendously facilitated by the advances in computing technology, which can support huge data sets, plus all kinds of compute-intensive methods. Let me give a quick overview of the major sources of microdata. Of course, Statistics Canada is a key organization where microdata are developed directly from things like the population census and household and business surveys. StatCan houses all kinds of federal administrative data, particularly things like tax returns, and some provincial data, and some private sector data. Provincial governments are another major group in Canada, especially with regard to healthcare, education, social assistance, administrative records. Canada has some wonderful activities going on in the university sector, like the Canadian Longitudinal Study on Aging and the Partnership for Tomorrow Cancer cohorts. And we have a long history, decades, of Manitoba, the Ontario Institute for Clinical Evaluative Sciences, and the UBC group, housing for decades and analyzing their provinces' microdata. And more recently, the Canadian Institutes for Health Research has been funding things. There's nascent, novel, but challenging data from the private sector, social media megacorps, fire hoses of data, but there are important issues with accessing those data. I have to say a few words about microsimulation modeling. The vast majority of microdata analysis has a singular kind of focus or hypothesis. You ask a question, you go to the microdata, you do some statistical analysis, and you publish a journal article, maybe several. But many major questions involve what if analyses, especially with regard to policy. One example would be, how would population aging and disability trends affect the future needs and cost of long-term care? And how would this interact with the public pension system? There's also similar modeling issues related to the spread of the COVID virus. These fundamental questions can only be addressed by microsimulation models. And these kinds of models, in turn, require new ways of thinking about microdata analysis. Essentially, instead of one equation at a time, one needs to think about multiple equations, all specified in a coherent way, analyses in parallel. So it's a major bit of data synthesis, and I think a critical frontier for microdata access. Unfortunately, we're living in Canada with what I've been calling for quite a few years with a privacy chill. There's an inevitable tension between the need to respect individuals' privacy, that is a public good, important, and the public good benefits, insights, and more effective policy that we can develop with important microdata-based analyses. Data custodians, particularly in provincial governments, but also in federal and other places, face asymmetric incentives. They're going to be in deep trouble if there's a data breach on their watch. But if some researcher makes an important discovery about an adverse drug reaction or something like that, using data from for which they're custodians, there's no benefit to them. And so, not surprisingly, they often lean all too often on restricting access to the microdata. It's been greatly exacerbated, concerns about privacy, by the egregious behavior of a number of social media megacorps and private sector data breaches. So it's really important for the public good research endeavor to build and maintain trust with the public and to differentiate ourselves from the private sector bad actors. Privacy commissioners are not a natural ally here because their obligation is to protect privacy, and we really do lack equally strong countervailing voices. I would think that the heads of research granting councils should be more outspoken on this. Let me conclude with a couple observations on, I put a question mark here on windows of opportunity. In Canada, there's important federal-provincial division of activities. The federal government tried very strongly to incent the provinces to develop interoperable electronic health records, spending billions of dollars, and we're not there. So that's a failure. Statistics Canada has developed a network of research data centers, but there's still, when I was at Statistics Canada, I continually heard gripes about difficulties in accessing the data in the RDCs, and I've been impressed by the successful approach in the Netherlands. And most recently, just last week, the federal government is yet again offering billions, literally billions of dollars to the provinces. In this case, they have the tranche for testing, contact tracing, and data management, but there are no strings attached, as far as I can tell, for the confidential microdata flows. So Canada has a potential here, it seems to me, of in not only incenting, but compelling in some way the provinces to be more cooperative on microdata flows, but so far it doesn't seem to be working. So let me conclude there, and I'll look forward later to the questions.
Michael, thank you for those insightful remarks. I think the tension between privacy and accessibility is a persistent issue across all of the countries, but I think in particular, Ron will have an appreciation for that as the Census Bureau is conducting its decennial census, where those questions regularly come up in all of these countries. So with that, let me introduce our next speaker. Ron Jarman is the Deputy Director and Chief Operating Officer at the U.S. Census Bureau. Ron led the team for the 2017 economic census, which went to 100% internet data collection and leveraged enterprise investments to minimize system application dissemination costs. In previous roles, he also oversaw a broad research program in statistics, survey methodology, and economics aimed at improving economic and social measurement within the federal statistical system. Since beginning his career at the Census Bureau in 1992, he has also served as the chief economist and as chief of the Center for Economic Studies, and as a research economist. He was there very much at the start when the American research data centers were broadening their access. So, Ron, your turn.
Thank you, Lars. I'm very happy to be part of celebrating the 20th year of the Canadian Research Data Center Network and its partnership with Statistics Canada. While the US RDC network is a few years older, it is safe to say that our systems went through a lot of our growing pains together. We learned much from Gustav Goldman and colleagues in those early days, and I imagine they gleaned a thing or two from us as well. Although differing legal and institutional foundations impact the nature and operations of the two networks, they both become indispensable assets for research, evidence-based policy, and statistical innovation. One of the key differences between the CRDCN and the FSRDC network is how they were established and the related differences in research focus. Whereas the CRDCN was established largely intact, the US RDC network evolved over time. US RDCs originated in the mid-1990s as an expansion of the research program at the Census Bureau's Center for Economic Studies, or CES. CES was established in the early 80s to develop and support research on a longitudinal establishment database and public use microdata from the decennial census and household surveys like the current population survey had been available to researchers since the 1960s. But it was not possible to release similar data sets for business surveys due to confidentiality concerns. Thus, the only way for external researchers to access Census Bureau business data was to collaborate directly with census staff. Further, there was no infrastructure in place at the Bureau to support such activities. So much of the early research featured collaborations between census staff researchers and academics who were often on leave as census fellows. The success of these early efforts increased interest amongst researchers in both academic and government settings in these new data resources. Seeing that the model of external researchers traveling to Suitland, Maryland was not practical, Bob McGuckin, the visionary chief of CES who hired me, certainly not why he's a visionary, pushed for the establishment of the first RDC located in the Boston regional office of the Census Bureau in 1994. There was some initial expansion over the 90s that led to the establishment of a partnership between the National Science Foundation and the Census Bureau in 1998 to develop a set of procedures to expand the network further. While the network was expanding physically over these years, the data available to researchers grew even faster. Both dimensions, as well as IT issues, contributed to the aforementioned growing pains. The original and still leading motivation for the Census Bureau's use of RDCs is to support research access to business data. This is one of the key differences between the US and Canadian networks. In both countries, business data are constructed from a combination of survey and administrative sources, which complicates access. An early challenge to the network in the US stemmed from IRS concerns about RDC researchers accessing federal tax information, or FTI, on Census Bureau projects. This not only cast doubt on RDC projects using census business data sets with the commingled FTI, but on access to FTI by the Bureau more generally, which was a grave, indeed existential threat to many key census programs. Fortunately, an agreement was reached that allowed FTI to be used on census projects conditional on establishing that their primary purpose was to benefit census programs. While adding an extra hurdle for researchers to clear, it made the agencies with rich administrative data, like the IRS, important and active partners in the RDC network. Indeed, the last important dimension of expansion of US RDC activities I'd like to discuss is the addition of other partner agencies. Unlike Canada with the unified statistical system, the US statistical system is spread across several agencies. And starting in the mid-2000s, the Agency for Health Research and Quality and the National Center for Health Statistics began to permit researchers to access their data at Census Bureau RDCs under a reimbursable agreement. More recently, the Census RDC system was rebranded as the Federal Statistical Research Data Center, with several other federal statistical agencies joining the network. The FSRDCs are now jointly governed as a partnership between the agencies and the RDC partner institutions. Following guidance of the Evidence-Based Policy Making Act to make access easier, the FSRDCs are piloting a single application portal, no small fee given the number of lawyers that are involved. So if you've been paying attention to the sessions for this conference, you should now know well the value of RDCs for research and evidence-based policy. Let me close with some remarks about the value of the work of the RDC's support to the statistical agencies that supply the data. First, and most obviously, RDC projects are a critical way to extract more value from data that are collected and processed at public expense. The agencies don't have the time or the resources to examine all relevant policy and research questions that could be addressed with their data. So RDCs are a way to leverage that initial public investment, get more value added from existing data, and build support for agency programs. Second, the RDCs help agencies improve their research capacity. Importantly, this is not just by gaining access to academic researchers working in the labs. RDCs provide a network of researchers working both within and outside the agencies that innovate and improve measurement. As junior economists at CES, when we were opening the first RDC in Boston, we assumed that the Bureau would no longer need us if all those Harvard and MIT folks could access the same data. But rather than seeing the research function of CES diminish as the RDC network grew, we saw CES researchers thrive as they were part of an expanding network of researchers using similar data and tools to explore issues in economic measurement in new ways. The collaboration across census headquarters and RDC nodes is probably one of the RDC network's greatest achievements and a key source of its value. Third, and building off the importance of collaboration, is the fact that the RDCs have been indispensable in helping the Census Bureau innovate by introducing new statistical products and developing new methods and tools. As we look towards building a 21st century statistical system, the network of experts and researchers facilitated by the RDCs will be critical in driving innovation. To be successful, though, we'll need to find new ways to deploy new data sources, tools, and computing power to the network, and to bring in new collaborators, for example, from the private sector, to move the 21st century measurement agenda forward. Thank you.
Thanks, Ron. I think the broadening of data providers, including to other agencies, even if just at the federal level, and private providers, is one of the key challenges that many of these research centers face, and a great opportunity for researchers. The challenge of coordinating such various approaches is also something that the UK has tackled, and I'm thus happy to now introduce Andrew Ingley, who is Head of Research and Data Evaluation at the Office for National Statistics in the UK. He's worked as the head of policy impact and engagement for the Secure Research Service of the Office for National Statistics. He's currently not doing that. He's currently on secondment as part of the COVID-19 response to the new Joint Biosecurity Center based in the Test and Trace program in the UK. He heads up the research and data evaluation and acquisition function there, which aims to identify ways of securely linking health and non-health data to assist the containment of the pandemic. So Andrew, with that, over to you.
Yes, thank you very much, Lars. And I'd just like to say it's a great honor to be invited to talk to address this group and to just share a few reflections from the experience of the United Kingdom. So what I'd like to do today is just talk a little bit about some of the drivers for the creation of the Secure Research Service at the Office for National Statistics. And then I'll just go into a little bit around the history and the growth of the Secure Research Service and the development of a unified UK statistical system. And then what I'd like to do at the end of that is just to offer some reflections from the perspective of the COVID-19 response and the pandemic, and some observations about the strengths and weaknesses of the United Kingdom microdata provision system that have been exposed by the current pandemic. So just to start, I think that there are a few drivers for the creation of the Secure Research Service at the Office for National Statistics that are probably very common to countries that are represented here in this forum and elsewhere. And so I think the general context for the creation of the Secure Research Service was the data revolution, the emergence of big data, the emergence of evidence-based policy making as a key approach to government, and a particular emphasis inside of that on policy evaluation, particularly using statistically generated counterfactual samples to measure the impact of policy interventions. And finally, I think there was a general recognition at the turn of the last millennia of the recognition of the power of data linkage versus matching or overlaying approaches that had often been used up to that point. There are a couple of specific elements in the UK context that I think also were drivers for the creation of the Secure Research Service. One of those is the fragmented administrative data landscape, where in the UK we tend to have powerful government departments who are data fiefdoms and who historically have placed walls or walled gardens around their data access and data provision. Secondly, we have a general political culture and historical distrust of big government data collection. And I think that's expressed most concretely in the lack of a national ID card or a national ID number, which would easily facilitate data linkage across government. So I think it's in that context, in 2003, that the Secure Research Service was established at the Office for National Statistics. It was originally known as the Virtual Microdata Laboratory, established in 2003. And for a while, I think it could well be characterized as a fairly niche and obscure service within the broader ONS estate. It was boosted in 2007 by the Statistics and Registration Services Act, which formalized the role of ONS in microdata provision and also created the UK Stats Authority as the owner of the UK statistical system. I think this is really an important step in the creation of a joined up UK statistical system. And that then in turn provided the impetus for the development of the 5 SAFEs model and the approved researcher scheme, which was run by the ONS to govern access to microdata provision. So since then, some further milestones have been the partnership with the UK Data Service, which is the academic data repository in the UK, supported by the ESRC and UKRI, and the primary microdata provider to the academic community. And also alongside with that partnership, the creation of the Administrative Data Research Network, the ADRN, which has now become the ADR UK. And again, the intention is to join up the acquisition and provision of administrative data across the UK statistical system. That has facilitated the creation of a network of data owners, a network of data providers and trusted research environments, and also joined up data provisions with the rather unique devolved administrations that we have in the United Kingdom, Wales, Scotland, and Northern Ireland. And finally, I think the final milestone that I'll mention here is the Digital Economy Act of 2017, which created an overarching data governance regime compatible with both the EU General Data Privacy Regulation, the GDPR, and the UK enabling legislation, which was the Data Privacy Act of 2018. So overall, the Digital Economy Act created a legal accreditation regime based on the ONS approved researcher scheme that I've already mentioned for accrediting data providers, and so trusted research environments, data projects, and also accrediting researchers to work on those accredited projects, all accredited through the Independent Research Accreditation Panel. So I'd just like to come on to some of the lessons learned in the building of this UK statistical system, but most concretely the provision of microdata through that statistical system. I think COVID-19 is an interesting lens to examine the strengths and weaknesses of the microdata provision regime in the United Kingdom. The strengths I think are fairly obvious. We have a fairly mature data infrastructure. We have a galaxy of stakeholders who are fairly clearly delineated. We've got a clear data governance regime, and we've got a lot of thinking that is emerged around what I call data compact between citizens and government, which addresses some of those historical, political, cultural reluctances around access to microdata that characterize the United Kingdom. The weaknesses, however, I think have also been exposed by the current situation. And the weaknesses are, I think, will come to dominate a little bit of the agenda moving forwards in terms of microdata access and microdata provision in the UK. The most glaring weakness is the lack of join-up between health data and non-health data. Patient data was explicitly excluded from the Digital Economy Act, and at the time that seemed to be a relatively obvious and perhaps commonly acknowledged step in the right direction. However, the pandemic has, I think, exposed perhaps the necessity of joining up health data with non-health data. And it's also eroded the boundaries between what has traditionally been considered as health or patient data and non-health data. So, for example, concretely, we're wrestling with the fact that is contact tracing data in the UK, is that considered health data or is that considered non-health data? So we've inherited a system that in the vernacular is designed for peacetime, but how well is it adapted for a national emergency? There have been questions around the flexibility of the system, particularly things like the inability to run big data models inside trusted research environments, some of the tooling around it within our data infrastructures. There have been questions around the inability to export data, which, as Ron has just gone through, is obviously one of the most important functions of a trusted research environment, to protect those data from escaping into the unregulated domain. And then that leads us on to the role of statistical disclosure control, which is often seen as a blocker and a slowdown in the timely provision of research outputs and actionable research outputs from our trusted research environments in a situation such as the COVID pandemic. So the effects of all of this in the UK have been that, ironically, this has led to the emergence of ad hoc pop-up systems to respond to various information asset owner and data providers' needs in the COVID pandemic. And so a certain fragmentation of a data infrastructure that was reaching a certain degree of maturity. So I think in conclusion, what I would say in the UK is that on the positive side, attention has been focused as never before on microdata. But from my perspective, I would suggest that the outcome for the existing data infrastructure is relatively uncertain in the context of the pandemic. And I think it's almost inevitable that in the UK, we are going to see another overhaul of the data governance system in the aftermath of the pandemic. So thank you very much.
Thank you, Andrew. I think the current pandemic is an unfortunate proof that timely and rapid access to pertinent health and social data as a basis for robust scientific analysis is vital and hard. If ever there was a need for evidence to base policymaking on, it is the current time, regardless of which country you're in. Il me fait plaisir d'inviter Madame Roxane Silverman, chercheure émérite au Centre national de la recherche scientifique en France, professeure honoraire au groupe des écoles nationales d'économie et de statistique et conseillère scientifique au Centre français de données sécurisées, à vous adresser la parole. Depuis les années 90, elle a joué un rôle majeur en France, et en Europe d'ailleurs, dans l'ouverture de l'accès aux microdonnées officielles en établissant la coopération entre l'Institut national de la statistique, l'INSEE, et le ministère de la Recherche. Elle coordonne actuellement l'IDAN, International Data Access Network, un projet de collaboration entre 6 centres de données de recherche en France, en Allemagne, aux Pays-Bas, au Royaume-Uni, afin de faciliter l'utilisation transfrontalière des données à accès contrôlé par ces pays. C'est un projet avec beaucoup de promesses, mais en premier lieu, Roxane, à vous la parole.
Merci beaucoup. Bien, mais je suis absolument ravie de pouvoir participer à ce débat au moment de l'anniversaire du réseau canadien et d'y apporter quelques réflexions à partir de mon expérience en France. Bien. Voilà, donc si je retourne 20 ans en arrière, nous avions difficilement ouvert l'accès à quelques fichiers anonymisés de l'Institut national de statistique publique et déjà apparaissaient de nouveaux problèmes avec des fichiers pour le recensement qui étaient considérés comme trop détaillés. Et j'ai été chargée de rédiger un rapport au ministre sur les problèmes d'accès aux données confidentielles. Et dans ce rapport, je mentionnais les centres sécurisés et déjà celui de Montréal, que j'ai visité d'ailleurs juste quelques temps après. Il a fallu cependant 8 ans après pour ouvrir ces données confidentielles à la recherche avec la création d'un centre d'accès sécurisé. Depuis 2015, cependant, le retard a été non seulement comblé, mais je crois que l'on peut dire que la France figure probablement dans le peloton de tête avec une ouverture qui, depuis 2015, s'est accélérée, s'étendant aux données fiscales, aux données médico-administratives, puis à l'ensemble des données administratives. Et je rappelle qu'en France, les données administratives ne relèvent pas du périmètre de l'Institut national statistique, avec justement une fragmentation qui rend les problèmes plus difficiles. Les données qui sont maintenant disponibles via le CRDCN couvrent désormais un très vaste ensemble de données de producteurs très différents, comme vous le voyez, y compris de données maintenant privées. Comment en est-on arrivé là il a fallu d'abord évidemment modifier les lois. Je me souviens du tollé quand j'avais écrit dans le rapport rendu en 99 qu'il fallait modifier la loi sur le secret statistique, et pourtant ces lois ont été modifiées à de nombreuses reprises. 3 remarques. Chaque fois, la mobilisation des chercheurs avec des cas concrets a été un élément très important. Les besoins d'évaluation des politiques publiques ont joué aussi un rôle très important. Les chercheurs, d'ailleurs, sont très souvent en fait sollicités pour cela, et cela a joué un rôle. Enfin, la pression qui a été exercée par l'open data et qui continue à l'être est, je pense, un facteur favorisant, même s'il concerne d'abord les données anonymisées. Et ainsi, la loi pour la République numérique, le Digital Law, a inclus des dispositions qui facilitent l'accès pour les chercheurs à l'ensemble des données administratives protégées par des secrets, et elle a aussi ouvert la possibilité d'appariement pour la recherche sur le numéro national d'identification, ce qui est évidemment un enjeu tout à fait crucial. Un dispositif sécurisé a été quand même au cœur de ces avancées. On n'aurait rien pu faire si on n'avait pas eu ça. Le CRDCN a été créé en 2008, juste en fait avant le passage de la modification de la loi sur le secret statistique. Aujourd'hui, le CRDCN est un groupement d'intérêt public qui associe l'INSEE avec la recherche, en particulier le Centre national de la recherche scientifique. Comme nous étions en retard, on n'est pas passé par l'accès sur site, on a directement choisi l'accès à distance, et un accès à distance où les chercheurs peuvent voir les données, c'est-à-dire directement les manipuler, ce qu'ils apprécient évidemment beaucoup. Avec le retard, nous avions également la possibilité de profiter de l'innovation technologique, et c'est un système totalement intégré qui a été créé, entièrement contrôlé par le CRDCN, facile à déployer et accessible uniquement via l'équipement d'accès dédié, SD Box que vous voyez là, après authentification biométrique. C'est une très haute sécurité, mais qui est alliée à une très grande facilité de travail pour l'utilisateur, avec tous les outils nécessaires pour travailler, y compris en réseau avec d'autres chercheurs, jusqu'à la rédaction finale des articles à l'intérieur de la bulle sécurisée du projet. La gouvernance, une gouvernance forte et transparente, a également été un élément important. Il y a un comité du secret statistique présidé par un conseiller d'État qui associe producteurs, chercheurs, et il faut l'accord évidemment du producteur et les autorités en charge de la protection des données. Le CRDCN est un deuxième niveau, il effectue les contrôles d'anonymisation des résultats selon les directives qui lui sont données par les producteurs. Et le résultat, c'est évidemment un grand nombre de projets qui sont affichés immédiatement sur le site du CRDCN, ce qui est également un facteur de transparence, et nous avons une évolution importante du nombre d'utilisateurs du CRDCN. Pour autant, il y a de nombreux défis aujourd'hui à relever, et c'est sur cela que je voudrais finir. Premièrement, on observe de plus en plus de projets qui ont besoin d'utiliser des fichiers, un grand nombre de fichiers de plus en plus gros, ce qui suppose plus de puissance, mais avec toute la sécurité nécessaire, et donc les problèmes effectivement de ne pas recourir à un cloud extérieur. Deuxièmement, on a un grand nombre de projets maintenant qui requièrent des données confidentielles de différents domaines, par exemple des données de la Banque centrale, de la statistique publique, des données socio-économiques, mais aussi d'environnement et de santé, on l'a bien vu avec la pandémie, des données santé d'origine diverses. On voit des centres de sécurité dédiés maintenant qui tendent à se multiplier, créant ainsi des silos. La question, c'est quel degré de concentration, avec les problèmes que cela peut poser quand même d'inquiétude, ou quel degré de coopération et comment entre les centres. Troisième problème, avec l'ouverture des données administratives de très gros fichiers et les appariements, quel archivage sur le long terme? La loi européenne sur le règlement européen de protection des données personnelles met en principe un terme assez bref pour l'archivage. Il y a eu des discussions à ce sujet en France et pour l'instant, la prééminence a été donnée aux archives nationales qui peuvent sélectionner pour un archivage à long terme au-delà de ce que permet la loi sur la protection des données personnelles. Quatrième problème, l'ouverture du périmètre des utilisateurs. Au départ, c'était très très limité à la recherche. On voit qu'il s'étend de plus en plus, administration, études, intérêt public, jusqu'où c'est une des questions. Tous les pays ne font pas la même chose. Croissance du nombre d'utilisateurs, quelle pratique pour le contrôle des sorties qui augmente avec évidemment beaucoup de temps pour les centres d'accès sécurisés qui l'utilisent. Dernier problème, et c'est là-dessus que je terminerai, un enjeu majeur, l'accès transnational. En France, nous avons très vite eu une ouverture très forte. Toutes les universités des pays de l'Union européenne et des pays associés ont un accès aux données françaises à distance. Et récemment, le Canada et les États-Unis, avec quelques conditions, ont également cet accès. Mais les difficultés sont encore nombreuses. Pour de nombreux pays, les déplacements sont nécessaires. Il y a parfois des conditions de résidence. Les projets qui requièrent des données de plusieurs pays et qui veulent les utiliser conjointement font face évidemment à des silos et ne peuvent pas le faire. Or, la loi est en général silencieuse, comme l'ont montré les discussions que nous avons eues dans le projet Data Without Boundary au niveau européen et à l'OCDE. Et en réalité, c'est souvent la sécurité et les clauses contractuelles qui sont au cœur. Le règlement européen donne une base légale pour le transfert de données confidentielles à l'intérieur de l'Union européenne, mais également avec des clauses contractuelles hors de l'Union européenne. Pour autant, au niveau des microdonnées européennes d'Eurostat, on attend toujours un accès distant, alors que le règlement européen sur ces microdonnées l'autorise depuis 2013. Et par contre, nous avons mis en place une initiative International Data Access Network, IDAN, le réseau IDAN dont parlait Lars, avec 6 centres sécurisés, dont le CASD, 4 pays. Et l'idée, c'est de pouvoir faciliter cet accès pour les chercheurs à des données de plusieurs pays. Le premier pas a été d'installer dans chaque centre les accès à tous les autres centres. Je vous remercie.
Merci Roxane pour ces commentaires. En tant que membre et maintenant président du conseil scientifique du CASD, j'ai pu admirer de proche les progrès que le CASD a fait à très grande vitesse. Je pense que ce qui est le plus impressionnant, c'est la quantité de données provenant de multiples agences et ministères. C'est quelque chose qui est très impressionnant. Ce problème de silo entre les différentes agences à l'intérieur même d'un pays, sans même compter à travers les pays, est un des plus grands problèmes que je pense qu'on a vu à travers toutes les présentations. Merci donc. This concludes the pre-recorded portion of this panel, the panel on microdata access perspectives from Canada, France, the UK, and the US. We invite you to please stand by as we transition to the live Q&A session with our panelists and myself. If you have yet to do so, please submit your questions. We're looking forward to them. The live Q&A is starting now. Welcome to the Q&A session. We've started to collect some of the questions coming in through the chat and the Q&A tab. Let me start immediately with a question that came in response, I think, to Ron's description of how access to health and non-health data occurs in the US RDC. So the question from one of the anonymous attendees is, are there linkages between health and non-health data in the United States? Ron?
So I think, as with projects in the US RDC system, if they come from multiple source agencies, all of those agencies need to approve the given project. I'm not sure that there's been very many if any, linkages between, say, like census data and AHRQ or NCHS data. They could happen, but I think generally, folks are accessing, various data products that are produced by one of the particular agencies. I mean, obviously, many of the census projects, because census does a lot of data linkage itself, have data sets that are linked from different sources, but those are usually sort of internal to the census processing. Like all of our business data are typically commingled with information from the Internal Revenue Service, and so we have a very good partnership with the IRS about how to grant access to those projects. So.
Yeah, I mean, I've personally, at least as data editor and reader of economics articles, seen articles that combine mortality data and any of the health questions that do show up on the American Community Survey, but we'd have to ask the RDC administrators to see what's currently in the pipeline in the RDCs.
Yeah.
I'm going to use that as an opportunity to pivot a bit to Michael, since you had also mentioned some of the data silos still in existence in Canada, and one of the most striking data silos is the one between health data and Statistics Canada house data. One can think of alternate research data access networks other than CRDCN that actually have access to health data. Where do you see the next jumps in data accessibility? Do you see some of those networks merging or combining in Canada?
That would certainly be my hope, and I think there's a lot of important initiatives. The Canadian Institutes for Health Research have been funding something called SPORE, the Strategic Patient-Oriented Research Project, and there are SPORE nodes across the country, and recently they funded a pan-Canadian node. The Canadian Institute for Health Information is involved, and they receive data from the provinces, and they also act as a conduit for health-related data to Statistics Canada. StatCan links the data that flow from the provinces either directly or through CIHI to the census, to the cancer registry, to the mortality statistics. I think there are a great number of people in the country who are keenly interested in seeing this happen. I confess, though, that I'm personally quite frustrated. Indeed, I wrote an op-ed raising concerns. The federal government is currently transferring literally billions of dollars to the provinces, most recently in something they call the Safe Restart program, and part of it was supposed to be testing, contact tracing, and data management, but there are no strings attached. So, and you read the agreement, and there's still, I'm afraid, unfortunate resistance on the part of the provinces to making their data available to bona fide public good research. I have a couple of hypotheses about why they're afraid. One can imagine that they don't want some smart aleck analysts pointing out things they're doing that isn't as optimal as one would like. But so this remains a major challenge, but there are opportunities and things are emerging. I guess I should also mention the Canadian Longitudinal Study on Aging and the it used to be called the Partnership for Tomorrow project. These are both very large cohorts, not unlike the UK Biobank in scale for Canada. But at the moment, the survey parts of those things are available to researchers across the country, but the provincial healthcare data, which can be linked, remain in silos province by province. It's so tempting, so tantalizing, but so frustrating that these data cannot be brought together.
Thanks, Michael. Switching topics a bit, a question was asked in the Q&A about the ability to engage researchers to develop tools, methods, and documentation to make access and the data within the RDCs easier. I know that has always been a challenge. I've been involved myself in the US one. I've observed the increased documentation showing up at CSD. Maybe turning to Andrew, what has the UK been doing to sort of make that more available before turning around and asking a question to all involved? What can we do to leverage that those hundreds, thousands of researchers that have used the data, that have specific knowledge on getting that out there to new researchers and getting them engaged?
Yeah, thanks, Lars. Probably I'm going to give you a slightly pessimistic answer, which is that I think that if there is an area where the UK has lagged behind a little bit, it is in the provision of documentation and engaging with the research community to build up that documentation. So, for example, one of the weaknesses that we have in the Secure Research Service is that in order to get data descriptions and to get the full metadata, one has to actually have an account in the Secure Research Service, which means that one has to have already requested the data. And so you can see a little bit right there, the problem. Yeah, how can you request the correct data? How can you do that efficiently when you don't have access to the correct data catalogs and the correct metadata? So my honest appraisal is I think we've got a ways to go. We've got some of the mechanisms in place, and there's some thinking that's gone on around that. But we do have some user communities that we've been trying to build up. There was a wiki that's developed into a more general user community, obviously GitHub repositories, those sorts of things. But I would honestly say we've got a bit of a way to go in the UK to get to a desirable place from a research perspective.
Well, I've been intrigued by the idea of sort of a nationally accredited researcher with access to the confidential data. That kind of breaks part of that cycle of you have to know what to ask for before you can become an accredited researcher. Now you can just become one, and that opens up doors both to confidential data and to confidential documentation of those data. Was that part of the intent, and how has that played out since the Digital Economy Act became active?
Yeah, that's a really good question. It was part of the thinking behind that. So I think there was a real intention to try and professionalize, in some sense, what was a fairly sort of ad hoc access regime, and also then to develop some common standards around that. So in that sense, I think the DEA has been quite successful. The other part of the DA, which is often forgotten, is it doesn't apply only to Secure Research Service. It governs any access to any trusted research environment through which data sets acquired through the Digital Economy Act apply. So again, there's a standardization of access protocols across the UK. To that extent, I think it's been really successful. And possibly something of a model which at least is worthy of attention outside of the UK. As I've suggested, I think there are some weaknesses inherent in the system, and it's not perfect. And I suspect that coming out of the COVID pandemic, we're going to see a little bit of rethinking of the data governance regime in the UK. But it's certainly a good place to start. And in terms of the most important things, for the Office for National Statistics, which are the values that we try and promote with access to microdata, trust and transparency, I think it goes a long way towards addressing those concerns.
Yeah, I agree. Let me pivot to a different question that has come up through the Q&A from Grant Cameron. Canada mentioned the challenge of accessing health data from the provinces. Subnational government entities are generating more data that are useful for policymaking and tracking outcomes. Is data integration between federal and subnational entities the next frontier for joining up data for research? And what kind of progress on this front will happen the quickest? Let me start with Michael as he sees it for Canada, and then maybe turn to Ron and Roxane to see how this is happening in the US and France.
I'm trying to think of some good examples with regard to sub-provincial data. Recently, there's been, all across North America, the Black Lives Matter, and we recently released a report from the Canadian Statistics Advisory Council indicating that a major data gap has been information on racialized and Indigenous populations. While the collecting of that data, for example, from police forces, StatCan works directly with police forces all across the country, that's sub-provincial, through the Center for Criminal Justice Statistics. And it's going to be a challenge because I assume, I don't know the details, that collecting better data and standardized data across the country on ethnicity or racial situations is going to require quite a bit of work. I assume there's a will, and that will just take some time to unfold. In the case of COVID and pandemic data, again, there's a hodgepodge. Toronto has one system that they decided would be better than the Ontario one to submit data to Ontario. But from StatCan or from the national point of view in the province of Ontario, the data roll up from provincial health authorities to the province and then come ideally to, I wish they would come to StatCan and to the Public Health Agency in full. They don't right now. That's another serious bottleneck. but the question raises an important issue, which is how does one manage to coordinate in Canada when the Fed-Prov relationships are challenging enough to work with the sub-provincial organizations, which will be, whether you're talking about courts, police forces, provincial health, municipal health organizations, universities, they're all over the map. That really adds an order of magnitude complexity.
Ron, do you have something to add to that? The one thing that comes to mind is the education that, say, the new education project that the Census Bureau has comes to mind as one example of this.
Yeah, well, I mean, obviously there's been partnerships amongst the various federal statistical agencies and federal sort of administrative agencies and states and local governments for many decades. But I think a lot of that was just to get some core information rather than trying to have a sort of a full integration. So, one of the things that we started a few years back that, Lars, you had a hand in was the LEHD project, where we took state unemployment insurance information, linked that together with some other census information to produce sort of labor market statistics. And so since the development of that, we've expanded that by partnering with a number of universities and university systems around the country to link student data. Basically, when folks graduate from the university, we get the administrative data from the university, and then we link that to the labor force data, and using sort of modern disclosure protection methods, we're able to produce statistics, so that sort of show 1, 5, and 10 years out, what students are earning in the labor market on degree field by campus. So if you're a family thinking about, where to put your educational investments, this kind of data, I think, is very useful. We've also just partnered with the U.S. Army to do something very similar. So on the same token, we take information on when folks are discharged from the military, and then we link that to the labor force data. And obviously the Army is very interested in this, as are members of the military, to see how different tracks that people take through their military service, how that prepares them for labor market success when they're done. So very exciting stuff. There's lots that can be done. I think we're really only scratching the surface, and there's lots to do here, and that'll keep us all busy for many, many years.
I'll also point out that each one of those projects had several years of preparation, and they're very labor intensive. They're not just data intensive. Roxane, la France est un pays assez centralisé, mais dans quelle mesure est-ce qu'on a des données qui proviennent aussi des municipalités ou des départements vers le CRDCN?
Oui, je pense que c'est une question très intéressante. Even before several years ago, I tried to set up the question for the National Statistical Office, and because we are a very centralized system country in France, they say, well, that's not really a problem. However, it is now we have a concrete decentralized process, and this is also increased by the European Union process, because the European policies address the regional level, and so at this so there are regions are even more and more producing this type of data. And for instance, even the universities, even if we have a rather centralized system to follow the students, we also have this problem at the level of universities that they all have their own system. So it is an increasing problem, and we are now having the first request from administrative, from regional system to perhaps to share the data through the CISD for this research. So I think that even if, of course, it's not the level that same level that we can have at the federal level in a country like the US, but we have this kind of problem in France also. And I think that in the future, it will be an important issue.
Yeah. Maybe last but not least, Andrew, the UK has always confused me with its diversity of data flows, confidential and otherwise, but I think you mentioned some initiatives of local data access combining it with ONS.
Yeah, thanks, Lars. I was just going to give everybody a perspective from the COVID pandemic. As Lars mentioned in the introduction, I'm actually on the secondment to the Joint Biosecurity Centre, where the data and data analytics component of the test and trace system in the UK, which is inherently centralized. But as we've stood up the service, there have really been two criticisms. One of which is that data has been shared with local actors in non-secure ways and often in rather ad hoc ways, and that's received some rather negative publicity in the UK. And the second one of which is I think even more important, which is as local lockdowns have been imposed by central government, that local actors have complained that there hasn't been transparency, they've not had access to those data, they don't know what lies behind the decision making. So my team have actually launched an initiative that we're calling Local Data Spaces. So we're working with ONS, with ADR UK, with HDR UK, and local actors to create data spaces in trusted research environments like the Secure Research Service, in which local authorities, local actors can bring in their own data and to merge it with the central test and trace data, and thus to gain insights which are of relevance to them at the local level. And so I think that's a quite practical example of some of the challenges that we face, and where I was talking about data fragmentation that have become quite evident through the pandemic, and we're creating these solutions. But we've just heard that that's actually going to be picked up, I think, by government, and there's going to be funding beyond COVID for the post-pandemic recovery period, and probably beyond that.
Okay, thank you. And that actually gives me a good lead into. So we still have a few questions. I'm mindful of the time of everybody who's attending this seminar. So one last question, maybe a minute from Michael, Ron, and Roxanne. Since Andrew, you already answered that to some extent. How could we strengthen the linkages between health and non-health data to inform domestic and international responses to COVID-19? Michael?
I think the data linkage and the multi-level stuff is so fundamental. You know, the big questions going on, and certainly in our country, and I think around, is, you know, what do you open, what do you close? The ability to take labor force survey data and figure out, you know, location by location, what are the employment impacts, what are the contact networks, and being able to put this together with the health data, you know, who's getting tested, who's getting infected, who's ending up in hospital. This is essential stuff. I'm afraid that I don't see yet, even though it's pretty obvious to me, the essentiality of it. Who's going to champion it beside a few research types? You know, I don't see the political layer in Ottawa and the public service at the senior levels being, you know, they're so preoccupied with fighting fires that they're not paying attention to these more fundamental concerns about getting the data flows in place so that we can actually have intelligent management, and recognize that the pandemic has got socioeconomic effects. They're fundamental, and putting the health and the socioeconomic stuff together is absolutely essential. That's not an optimistic answer, I'm afraid.
But it is an answer. I mean, we're all speculating here. Roxane?
Yes, je parle en français. Je crois que c'est un problème à la fois, on le voit au niveau national et au niveau européen, en fait, en ce moment avec la pandémie. Même au niveau français, où on a quand même pas mal de centralisation, on a été, au moment de la pandémie, ça a été très, très difficile, en fait, de mettre ne serait-ce que simplement le nombre de décès et les causes de mortalité, c'est géré d'un côté par l'INSEE, de l'autre côté par l'INSERM. Et là, c'est un problème. Au niveau européen, at the European level, we had recently a discussion at the National Council for Statistical Information that the European Union have been unable to really collect data from different countries in Europe with linking the health data and the socioeconomic data. And so I think it's really something that shows the difficulties. And I agree with, I think Andrew said that the pandemic reveals really the problems, I think. And especially so even in Europe at the transnational, if we have, in Europe, we have a transnational agreement within Europe, and even with this, it doesn't work.
Ron, any thoughts on that? The Pulse survey combined questions from multiple agencies, including on health, but that's not the same as combining non-health data within the statistical system. Right?
Yeah, I think, I think all the points that were just made about trying to bring different existing data sources together are going to have all of these problems. And, the sense of urgency during the pandemic, I'm sure will wane as we move away, and the ability to get people around a table and solve these data access issues probably, I would not bet a lot of money on that happening. But I think that's what, one of the reasons why, in this world of big data and all this sort of stuff, that surveys still matter. Yep. And I think that, with the household pulse survey, first of all, no administrative data has got a frequency other than payroll data has got a frequency of a week, and the ability to bring in a bunch of topical questions that people are worried about with the given sort of national emergency. I think that's something that really only surveys have the ability to accomplish. But if you could do those surveys on top of a layer of really rich linked administrative and other sort of longer term survey information, that would be very helpful. And I think that's kind of how we have to think about it, is how we have a really strong base of sort of basic information about the people and the economy, to be able to then layer on these other more topical type things and make them much more powerful. So
thanks, Ron. So we're at 2 o'clock. We will continue as long as we have a few questions if our panelists are willing, but I did want to sort of get a word in for those who need to leave at 2, or who should have left a minute ago. Tomorrow's session in this conference is precisely on the response to COVID-19, first wave assessment and second wave planning. So many of those questions might be answerable within that particular session as well. And of course, we've all brought up the tension between access and privacy in today's talk. We have an entire session on Wednesday that closes the conference on privacy and microdata access. And I invite everybody to join us there. But since we also have some of those questions here, let me continue with some of those questions, in particular as they regard the privacy. Maybe this is a question to all the panelists as far as they've perceived it from Rebecca. Do you think that the pandemic, and in particular the topic of contact tracing, Andrew evoked that as well, will change people's opinions on privacy? Andrew?
I got the loaded question first. I think
speculating.
Yeah, I think Ron. I think Ron touched on something, which is, it's very tempting to say yes. How durable that change is, I'm not so sure, and I think Ron's point was well taken there. Certainly in the UK, I think that we are in for a rethinking of some of the relationships between citizens and government. Frankly, the pandemic response at the beginning was not a particularly easy road from a data perspective and a data provision perspective. And as the pandemic has worn on, there's been increasing pushback from citizens about the precise use of data provided through contact tracing. You've probably heard in the, through media stories that contact tracers are reaching an increasingly lower number of individuals below what we would need to contain R. So it's a really live question. Part of that is around economic drivers for sure, but part of that is around concerns for privacy. So I think it's inevitable. There's going to be some rethinking of it. How durable that is, I'd like to hear Ron answer that.
I don't know.
Well, if I may just put a plug in there before I turn to some of the other speakers, we actually have a session at the next joint statistical meetings next year that just got accepted that will provide data on that from surveys on what people have changed looking through that. Michael, what are your thoughts, having called for some of this or observed some of this in the new funding things that go to governments, but that's not what the perceptions of respondents' privacy is, right?
My sense is that Canada's facing the same problem in contact tracing that we just heard Andrew mention, that people aren't very, less than half might answer the phone and provide information. And I take Ron's point that, the pandemic, hopefully sooner rather than later, but it will pass. But I think there are two longer term forces that are at work here. One is we've seen in many national statistical agencies declining response rates to surveys in general. And I don't think that long-term trend is going to change. And we're also, I worry, the privacy discussion more than 5 years ago was quite different because we didn't have Cambridge Analytics, and we didn't have these major data breaches from the big, as I call them, the media megacorps. Now, maybe the antitrust stuff in the US will actually do something over the next couple of years, but I really worry. And I think what we're seeing, certainly with the way StatCan and its modernization initiative is moving, is increasingly and more aggressively toward administrative data. That's not without controversy, but I think there's a major need to have a full and frank, as the diplomats say, discussion with the privacy commissioners about this. That's already started in Canada. And there was another thought that flitted in and out of my brain here. The use of, StatCan has been quite innovative in using internet-based surveys, things like that. I used to be very skeptical about those because there's clearly major issues of non-response bias. But the good news for StatCan, and I would assume other agencies, is with good, the census and with good labor force surveys, you can post-stratify the responses and at least get something moderately good. We've seen in US polling, the states that polling agencies that do a crappy job don't post-stratify by education in the current election down there. And pollsters have learned since 2016 that you really do need to post-stratify. That's such a basic thing in order to improve the accuracy of what you're getting. But the short answer is I don't see any major swing in public opinion that will make the privacy question easier.
Roxane, dans quelle mesure est-ce qu'en France, les opinions quant à la vie privée ont progressé et changé par rapport à la COVID-19?
Là aussi, moi, j'ai des sentiments un peu mêlés. I think that, we had a number of surveys that had been set up in urgency, and the rate of answers is very high. It's also in the for the epidemiology scores. So I think that here there is, people have really sent information. On the other hand, perhaps we have launched a second tool for tracing Stop COVID, and here it has just started 2 days ago, and the level of people, the number of people that are really using it is rather low. And so probably here, I think people are, it shows very well that people have mixed feeling. In a way, they understand the importance of having surveys, and on the other hand, they have really concerns about privacy. I think that the only important effect that I expect is at the level of governance. It will probably have a change in the governance to have a better connection between health data and socioeconomic data, especially in France. One problem that we have is that because we have a different law for the health data, we have a second secure center, and so this is a problem when you want to access to confidential data that are at CRDCN and in the health data hub. But so at the level of governance, yes, I think that there will be progress. At the level of citizens, I think probably people will stay with mixed feelings.
Ron, let me direct that question in a bit of into one of the next questions. There's, as a function of COVID, access to the research data centers that we've described has been curtailed because people can't literally physically go to those closed down centers. There has been access remotely that has, without going to an RDC lab, that has been piloted to some extent. To what extent is that a function of the relaxed attitudes to privacy potentially about where people need to go on the side of government that will broaden access by putting more trust, such as a trusted researcher in the UK, into researchers in the US?
Well, I think really that's just more a natural evolution. So, I mean, we were already thinking of moving towards a more secure remote access model rather than having to go inside of a locked facility. That we haven't, that's not been uniform across all of the different RDC participating agencies. But we know from an IT security standpoint, from a monitoring standpoint, that we can securely deploy, and we don't deploy the data. We can securely give access to the data in someone's office or in someone's home office, just the same as we can do it in an RDC lab. So I think much like we knew that people could telework before the pandemic just kind of was a trigger event to say, oh, well, now let's actually all telework. And I think similarly, this is just an extension of that. There was some limited piloting of this before, and obviously some agencies, that's how they've done it for years. So I think that this is just a realization that the infrastructure that we have is sort of agnostic as to whether it's deploying secure access inside of a locked room in an RDC environment or at your home office. There's not much more mischief that you can get into at home, and we can do all the same monitoring that we do in RDC lab. So, I think it was just a realization that the only thing we were doing was keeping people from doing work, and obviously some of these projects have some direct relevance to the situation we're in. So we wanted to allow people to have that access. So I think that's really more how that rolled out than any new thing.
Since I'm on behalf of the CRDCN board, I'm on the remote access subcommittee as well for the Canadian network. I can comment a bit on that to the extent that it hasn't changed. The process was in motion, albeit somewhat slowly. It has been possibly accelerated by COVID, but I don't think any of the access rules are changed because of that, only that the urgency has increased.
Lars, if I can jump in, the Canadian Statistics Advisory Council issued its report a week or so ago, and one of the key recommendations there was to really accelerate this process of allowing the secure remote access. And my colleagues on the council and at StatCan and some others know that I've been griping for 5 years now, because I was over in the Netherlands. I visited the Dutch Bureau of Statistics. I saw a researcher at NIDI, the Netherlands Interdisciplinary Demographic Institute, running a regression on the Dutch central computer from his office. They've been doing this for 15 years now, and I remain quintessentially frustrated that it's still taking too long for my former colleagues at StatCan to see the light, get moving. I appreciate that COVID is slowing things down. And you're right that there are pilots, but this could have been done years ago. So I don't know why we're not moving more quickly.
Well, we are discussing it, but I agree with the point about moving quickly. So we are coming up on our hard stop at 2:15. Maybe one last question, if we can squeeze it in there. Andrew, should ONS worry about disclosure control regarding administrative data that they already use and that's already in open data access?
But I think it would be fair to say that ONS always worries about disclosure control. So there's that. Probably just coming back to the observation that we started with, which is that tension between creating a secure system for access to microdata for legitimate research purposes, and so which implies some degree of control, and then the potential for fragmentation across the systems, given that there are so many admin data sources. the fact of the matter is that there is the way the system's supposed to work in the UK, and then there's the way the system actually works, and those are two slightly different things. And there have been, well, just to come back to COVID, there's been a temptation sometimes perhaps to circumvent the very carefully thought out data governance regimes just because we're in a period of national pandemic. So I think ONS particularly has been very worried about pressure on ONS and also other statistics producing agencies to shortcut or to go around statistical disclosure control procedures or to provision data through mechanisms other than trusted research environments. Probably, Lars, the last thing I'll just tell you is that we in ONS have actually now moved to completely online access for microdata. So anybody can, with no box even, so just your laptop, as long as you're an approved researcher, you can access microdata on your laptop. It's a real sea change for us.
Michael will get really jealous now.
I know.
Okay.
Right.
So I think we're going to have to close the session right now. We're out of time. Thanks to everybody for participating. Sorry if we couldn't answer all the questions, but do feel free to continue sending them to us. And like I said, there's two exciting sessions tomorrow and on Wednesday that touch on similar topics as we just discussed here. So the conversation can continue there. Thank you to all the panelists for taking the time to both pre-record your session and to participate today in the Q&A. Thank you very much.
Thank you, Lars.
Thank you. Have a good day.